what can I do to decrease my chances of developing depression, or if I have depression, on keeping going and sort of making my way through it? What would you suggest?
We need to understand what causes depression in order to figure out how we can prevent it or how to treat it or how to develop some resilience to it. Depression is a brain disorder, so there's a biological insult to the brain that can contribute to the overall syndrome. And so we have to look at what are the factors, biological factors, that can precipitate or cause depression. So if someone has a biological risk for depression, so family history or high genetic risk, then they're more likely to get it, and that's not a factor that can be changed. If someone has had depression in the past, they're more likely to have it in the future. So kind of preparing in terms of doing therapy and learning skills to cope with stress can be very helpful. Medical illnesses can cause depression. So if someone had a stroke, it's important to be attentive to the possibility of developing depression after, and work with them around social support, coping with the illness, having a chance to talk about their experience of illness as a way of helping promote resilience. Grief, sustained anxiety, substance use, this can also kind of get the brain stuck in certain patterns and lead to depression. And as one ages, there's the higher risk of developing medical illnesses or living with diabetes and high blood pressure and chronic illnesses and pain that can make the brain more vulnerable. So to support the brain biologically so that it doesn't get depressed, or to help with recovery, things that improve brain health. So the general advice: physical activity, good nutrition, good sleep, learning to cope with stress well. These things can be very helpful.